Hi, my name is Nadia, and today we're going to be learning how to perform a subcutaneous and intramuscular injection. So before we give any injection, we always have to check the MAR to see what the doctor ordered. Along with this, it's important to check the patient health history and double check whatever allergies they have. So when we go to administer the medication, we always have to follow the 8 rights of medication administration. These are the right patient, the right medication, the right dose, time, the right route, and right documentation, reason, and the right response. So when we go into the patient's room, we want to look at them generally and see, or just look at their body size, their build, and their weight. This will help us determine what the right spot to give the injection is. So the first type of injection we're going to be doing is subcutaneous. We will be injecting heparin. This will require a 25 to 27 gauge needle. It's typically used for both adults and kids alike. This needle goes directly into the fatty layer under the skin. So in this example, the medication ordered is 5,000 units of heparin, and the supply is 5,000 units in a 1 milligram vial or ampule. So we have it right here. And that would make us fill up 1 milliliter.
The first step to any patient procedure is hand hygiene. You'll typically do this for about 15 seconds. Once this is done, we can start to put on our gloves, and it'll act as a barrier between the patient and ourselves. Next thing we have to do is to prepare our ampule. To do this, we will safely break off the top of the container and be very careful as it is glass and it can cut you. Put the top of the container right into the sharp spin. Now that the ampule is ready, we can take off the protective cover on the needle, and when in position, begin to draw up the required 1 milliliter that is needed for the injection. Now it's important to remember, as soon as you come in contact with the patient, you have to confirm their identity, and you have to confirm the allergies that were on the MAR with them. Doing this will help prevent a medication error. Once you have drawn up your medication, squirt out any air bubbles or tap the vial to ensure that you won't be injecting it into the patient. Now we can recap the syringe to ensure there are no needle stick injuries. We can now start to prepare the injection site. A subcutaneous injection will typically be injected into the abdomen, back of the arm, and sometimes the thigh. When we're injecting on the abdomen, we usually want to be about an inch away from the belly button. So once we've cleaned the skin and we let it dry a little bit, we want to pinch the skin up, as this is the proper way to give an injection. So once the skin is pinched up, we're going to inject the needle at a 45-degree angle, and then inject the medication slowly, but at a good rate. Once this is done, we can clean the patient's skin again if there's any blood or residue from taking out the needle. And now it'll go right into the sharp spin.
Now we're going to be learning about intramuscular injections. We'll be performing an injection of Haldol, which will require a 21 to 23 gauge needle, just like this one here. Typically they're about 1 to 1.5 inches long, which we would use on a regular sized adult. If we have a larger patient, you typically go up to 2 inches because you have to puncture through more skin and fat. So as we know, intramuscular injections, they go right into the muscle tissue. So in this example, our ordered dose is Haldol, 1 milligrams, and the supply is 4 milligrams in a 2 milliliter vial. So if we do the math correctly, we're going to take up 0.5 milliliters in the syringe right here, and this is going to go right into the muscle tissue.
Performing an IM injection is very similar to a subcutaneous one. Begin the procedure by confirming the patient and their allergies, then begin with hand hygiene. Rub your hands until they're dry, and then place your gloves on. Now that our gloves are on, we can begin to put the syringe together by twisting the needle on. Because we are using a vial instead of an ampule right now, we have to draw back the amount of air that is going to be injected, so in this case, 0.5 milliliters. You can now clean the top of the vial, and once that is done, you can inject the air that we pulled back into the vial. This helps create more pressure in the vial to draw out the medication easier. Draw out a little bit more than the required 0.5 mils to get rid of any air bubbles that may have formed. You can just squirt it out until you don't see any more, and tap it. IM injections are typically injected directly into the large muscles, so the thigh, deltoid, and hip areas are great locations. Now we prepare the skin, and once this is done, we want to pull the skin tight and inject at a 90-degree angle. This needle has a protective measure, so we can cap it and then put it right into the sharp spin. The last step will be to perform our hand hygiene and document our findings, noting the injection type, site of injection, and any adverse reactions.